Let's go to the next position. This is what we call the kidney position. The kidney position. In the kidney position, the patient assumes a modified lateral position. So it looks like the patient is on the lateral side, and the abdomen is placed over the left and the operating table that bends the body. So just think about somebody in the lateral position, but then the body is a bit bent. Okay. Now the patient is turned on their contralateral side with their back placed on the edge of the table. That is what we call the kidney position. The kidney position. Okay. So now that we are done with this, I want us to look at positions for specific conditions. Positions for specific conditions. So before we move into these positions for specific conditions, we are going to look at specific positions for specific conditions. Okay? Because it is not enough to learn these positions and mass. You must also learn, okay, assuming this client has this unique condition, what position can I put the client in? Okay, so now let's go. If you have a client with air embolism, that is, air has gone into the bloodstream and probably it's gone into the heart. Use the Durant's maneuver, where you position the patient in the left lateral translembec down, that's the head goes down, to prevent the embolism from traveling to the lungs. Okay, so you put the head down so that it prevents the air from going to the lungs, because the embolism can kill the patient. What about pulmonary embolism? You want to elevate the patient's head to a high Fowler position to ease breathing. So if the patient has pulmonary embolism, you want to elevate the head. If the patient has air embolism, you rather want to use the Durant's maneuver. So that is why we have these two pictures, the Durant's maneuver and then the high Fowler position. So please remember the difference. Which one will you use for air embolism? I'll use the Durant's maneuver so that the embolism does not travel to the lung. But in pulmonary embolism, I'm going to elevate the patient's head to a high Fowler position to ease breathing. What about if I need to do tracheostomy care? I'm going to keep that patient in a semi-Fowler position or a Fowler position. And this will aid breathing. It will aid breathing to provide comfort to the client. Now, the semi-Fowler or the Fowler position. What about if we have a baby or a patient who has cleft lip and cleft palate? What kind of position do you want to keep the patient in? You want to keep the patient in an upright position during feeding because of the space, in the clefts. Because if you don't do that, they can easily aspirate. And in a post-op situation, the child must be placed prone. For lip surgery, avoid prone position. So these are hard facts you need to learn for your NCLEX exam so that you can be able to ace it very well. Okay. And then we also have, which position are we going to put a patient who has prolapse of the umbilical cord? We can put the patient in the knee to chest position, which relieves pressure off the umbilical cord. Okay, so the patient's knees are flexed towards the abdomen, or you can put the patient in the translembec position, because as I said, with the translembec position, you are reducing pressure which is going from the pelvic and allowing the pressure to move towards the upper part of the body, right? Don't forget that in the translembec position, the client's head is down and the legs are up. Translembec position, right? Good. And then what about if you need to do a liver biopsy? You need to do a liver biopsy. You need to position the patient on their right side to apply pressure and prevent bleeding. So you need to put the patient on their right side to avoid to apply pressure and to prevent bleeding.